Hello and welcome. My name is Devashish Sharma and you're watching Indian Spine Clinic by Dr. Devashish Sharma. So, how much time does it take to heal the L4-L5 disc bulge? It's a very important question. If you are having an L4-L5 disc bulge, the chances are that you must be also knowing the symptoms of L4-L5 disc bulge, which are low back pain, leg pain, tingling and numbness, and in rare cases, weakness of the legs and maybe or bladder bowel involvement. So these are the symptoms at a highlight, but how do we treat it and how much time does it take to heal? So first thing is, what is the chosen method of treatment which has been offered to you by your doctor? Primarily, if you have an L4-L5 disc bulge, the primary and the mainstay of treatment, I would rather say, is conservative therapy. When I say conservative, that means that we are trying to conserve the normal anatomy without interfering surgically, and we would want the body to take its time and heal, and all we are doing is trying to provide a suitable environment for the body to heal. So what includes conservative therapy? Conservative therapy includes, number one, lifestyle change. You have to do things which do not recurrently injure your lumbar disc, like not bending forward, not lifting weight, adopting a good posture, avoiding long sitting, avoiding jerky travel, etc., etc. Second thing is to ensure that you get examined by a doctor and you have no impending bladder bowel involvement or any weaknesses. If that is not the case, there is a high chance that your doctor is going to give you a physical therapy prescription, which may include physiotherapy, occupational therapy, chiropractors, and sometimes acupunctures. All of these things are great. All of these things work beautifully when it comes to lumbar sciatic problems, and many of my patients have had good relief because of them. So now, that being said, if you have either tried all this and it is not working and it's already been months, say for example 2 months or 3 months, and you're not getting better, then probably your doctor would want to know how bad is your herniation. Is it very severe? Is it less? Or have your weaknesses persisted, gotten worse or gotten better? If you're getting worse, or if you're not improving, or the pain is very bad, or any bladder bowel signs are there, then your doctor is likely to suggest you for a procedure. And generally nowadays it is either done through a microscope or through an endoscope, and sometimes very traditionally in an open way. But the smallest incision is through the endoscope nowadays. The little bigger incision is from microscope, and the biggest one is from the classical open spine surgery. I generally do it with an endoscope, which is one of the best technologies available as I speak to you in September 2024. Maybe if you're watching this video in 2034, the technology would have changed and what I say today may have become absolute. But in 2024, as of September, endoscopy is the best technology possible as far as spine is concerned, and it's most minimally invasive, fastest relief, and easy to access. So if you have that problem and if you're treating conservatively, the minimum time you should give should be 6 weeks, and the maximum time you can give yourself to heal can be around 3 to 6 months. If you're not healing by 3 to 6 months, there is a high chance that now it has become stagnated and the body is not able to recover from the amount of disc herniation what has happened. And in those cases, we recommend surgery to the patient. And as I already mentioned, surgery can be done with various ways. My favorite being endoscopy, because most of the times it can be done under local anesthesia with no anesthesia, sometimes under spinal, and in special cases under general anesthesia. It has zero blood loss, it is stitchless, it is painless, and the patient is ready to go home in no time with very, very, very good pain relief. Most of my patients recover almost instantaneously when it comes to pain, but I need to tell you that the numbness and the weakness may take a lot of time to settle depending upon case to case, and but inevitably most of the time healing happens perfectly and beautifully. So if you're not getting better, you may consult your your endoscopic spine surgeon or a spine surgeon anywhere, wherever you are, and they will take care of the problem. But primary mainstay is always conservative, and surgery is generally required for less than maybe 3 to 4% people. Rest of them always do well with basic therapies. So if you have that kind of problem, don't worry, you can get better. And mostly there are very high chances that you may just get better with only conservative therapies and no need of knife. Thank you very much. And this is my English channel series, mostly for the patients who are English spoken and from abroad. If you have any questions or anything which you want to say us, you can always message us or write to us on the given numbers. Thank you.